Hello and good evening and welcome to our live event tonight. It's good to be back again with Dr. Elias Tsakos. Hi, how are you feeling today?
Hi, Caroline. I'm feeling very well. How about you?
I am all good, and I'm very happy that you have decided to join our Stronger Together event once again. It's good to have you back indeed. And of course, let me just start with a few words, and we will then go with Dr. Tsakos' presentation. And of course, today he will talk about top tips for turning IVF into success. So remember that after Dr. Tsakos' presentation, he will be happy to answer your questions. So all you need to do is just type them in the chat section. And before we start the presentation, I just also want to mention that today, actually, we are starting our new kind of initiative as well. We are focusing on Greece as a fertility destination of 2021. And also, I just want to mention that we, in the upcoming weeks, yes, every single Friday, we will have a webinar with one of the specialists from clinic, which will be located in Greece. So thanks to those online events, you will also have a chance to get to know some of Greece's leading fertility specialists, like Dr. Tsakos, of course, and receive a lot of useful advice from IVF coordinators as well. They will be here. You already are able to sign up for those events, as you know. So yeah, that is it, what I wanted to say about that. And as always, I also want to mention that the Stronger Together events are brought to you also thanks to our ambassadors and partners, and all of them are right here on the screen. Thank you for your support. And well, that is it from me. Okay, we will go with the presentation. So Dr. Tsakos, are you ready to begin?
Absolutely, absolutely, Caroline. Thank you for the invitation, and thank you everyone for logging in and spending your Friday evening with us tonight. I was given this challenging topic, and I was expected to speak very medically. So, how do you turn a failure into success? So, I was tempted to talk about science tonight, but I'm not going to. So, if you're expecting to hear about hysteroscopy, about NK cells, or about embryo glue, or assisted hatching, you may be disappointed, because in my opinion, I think that this is information you can find anywhere. So I wouldn't like to monopolize your Friday evening and talking to you about techniques that you may be already familiar with. I will talk to you in general. I mean, I would like to give you my top 10 tips out of my 30 years experience in the field and with treating thousands of patients from all over the world. So what happens? I mean, how would I advise my sister or my next door neighbor if they had a failed IVF? This is exactly how I would like to approach you tonight. So first of all, I would ask you to pause. It's a reflex reaction after a failed IVF to say, "Oh my God, when can I go next? What can I do? What's the soonest I can have treatment again?" I mean, we are under a lot of pressure from our patients to restart treatment, if possible, next month, because they feel that the sooner they do it, the more successful they are. I would like to discourage you. I would like to ask anyone who's had a failure to pause, to give yourselves a little break. How long is that break depends on you. Could be 1 month, could be 2 months, could be 3 months. Trust me, it makes no difference to the outcome in terms of the aging effect. I mean, ask gynecologists who've been used to kind of pressurize our patients and talking to them about the biological clock. But trust me, it makes no difference if you do it in 2 months or 3 months, the second try after failure. However, it does matter if you take a little bit of time to look into the situation, to reevaluate, and to perhaps look into the relationship, take a break, take a pause. So that's my first tip. Don't rush into the next treatment. Have a pause. Number 2 tip, reflect. After any attempt, after any failure, in my opinion, there's 2 ways forward. One is to get stronger, and the other one is to stay on the ground. So if you want to be stronger, one has to reflect on the previous attempt. And in this reflection, you're not alone. You always have the clinic, the people you've trusted with your dream to parenthood. You can always ask them. You can always go back, have what we call the post-failure counseling, and see if you could find out, if you could identify any reasons why this has failed. Was it anything in the treatment that went wrong? I mean, was it anything that you did wrong, perhaps with the drugs? Was there anything in terms of the decisions you were invited to participate? For example, whether you had embryo day 3 or day 5 transfers. And please feel free during that reflection time to be honest with yourself, to be honest with your treating team, and to be honest with your feelings. Because if you reflect, then invariably you should identify some areas which could be optimized in any of the next attempts. Number 3, empower. You have to get up and you have to be strong before you move on. So what can you do to empower yourself? Anything. Anything that touches upon your emotions, that touches upon your body, that touches upon your spirit, upon your relationship, upon your decisiveness, if you like. So this is the time where perhaps you may need some help. You may need some help from the team that have treated you, from your coordinator, from your midwife, from your doctor, from the medical director of the unit, from a friendly embryologist that you got to know along the way. There's a lot of people. I mean, trust me, I don't believe there's any IVF unit, and I've visited quite a few, and I'm familiar with hundreds of them around the world. And there's no one who wouldn't like your success as much as you do. It's just that sometimes perhaps there's no means of providing you what you're looking for. However, if you're looking for this empowerment, don't hesitate to look back at the team that have supported you, and also don't hesitate to seek for help somewhere else. For example, a friendly acupuncturist, or a psychologist, or a dietitian to get rid of those extra pounds that you think that have made a little difference, or a fertility coach, or all of them together. So anything that would empower you, you and your partner, you by yourself if you're a single mother to be, you and the supporting team, because even single mothers to be, they have the mom or the friend or the neighbor or a cousin or a sister with them. So try to empower yourself as much as possible before you move on. Number 4, try to seek information. After a failed attempt, all of us are wiser. You, the patient, is wiser because perhaps now you know if this is a path that you've walked on before. So if you've done it the first time, second time is always easier. I remember of your favorite jogging path, how easier it is second time round, or second time within the same week, and so forth. So try to seek information. It's very important to crystallize some basic information about IVF, about success, about fertility, about your case. Now, there's hundreds of resources. I mean, the problem with the internet, of course, is that the information is there, but of course, it's very difficult for any of you to verify it and, of course, tailor it into yourselves. However, now, especially in those COVID times, it's very easy to get an online consultation. So don't hesitate, perhaps, to get a second opinion. Don't hesitate to get an online consultation from a fertility specialist. What we found over the last few months, the last 6 months, is that our fertility consultations are now fully booked for another 2 months because a lot of people are seeking information, regardless of whether they wish to be treated in our unit or not. So don't let go of this opportunity to get as much information as possible. And of course, you and your partner would be important to identify some reliable sources of information so that at least you know the basics. It's important to know, for example, the standard protocols. It's important to know perhaps the importance of measuring some hormones, although until recently most people didn't. It's important to identify perhaps the importance of the progesterone and whether this could be detrimental for an implantation, or how a mild ovarian hyperstimulation syndrome may affect your treatment, or what are the methods and what is the preferred option if you have too many eggs or too many embryos, or the pros and the cons of transferring one or two embryos and so forth. So the more informed you are, the more empowered you are, the more strong you are to take the next step. Number 5, explore the options. Frankly, in medicine, in life, in fertility, there's always more than one options. And it is our duty as medical professionals to explore the options with you. Some of us in some countries, I'm not going to name which ones, but there's a lot of restrictions. I mean, doctors are perhaps not as free as they would have liked to be when they wish to identify or to explore the options with the patients. This happens, for example, with egg donation. In some countries, egg donation is something that doctors are not quite allowed to talk about if it's not available in their own country and so forth. In some other countries, doctors are not obliged by the medical oath to talk about treatments perhaps unavailable in their country and so forth. However, we are in the globalized world, and one of the benefits, and there aren't just benefits as we all know, however, one of the benefits is that the world is your oyster. So perhaps after a failure, take a little bit of time to explore the options, to explore different countries, different practices, different strategies, different philosophies, and different approaches. So this is entirely up to you. I'm very adamant about this opinion, but I don't think there's anything in medicine or any medical intervention in which it may be the only option. There's always a lot of options, and it would be very important to explore all of them. Number 6, when you're doing all of this, it's very easy to go off track. Very easy. It's very easy to get sidetracked by maybe some questionable approaches, some approaches that may not have such scientific evidence, but normally and usually they sound quite attractive. It's very easy when you pause to pause for 6 months or a year. It's very easy to lose your sense of hope and the sense of wish and will to move on. So please, when you're doing all of that, all of what I've said just now and all of what I'm just going to mention in the next few minutes, stay on track. If you have decided, if it's been indicated, if it's been explained to you that IVF is the way forward, stay on track. Try not to backtrack. Try not to sidetrack. If IVF is indicated medically, then yes, IVF is the way forward. And then it's up to you, of course, to choose what kind of IVF, where, what kind of protocol, and so forth. And of course, if you have any specific questions, it's up to you to request, not demand, but request some sort of answers. So stay on track. Number 7, define. The definition of success varies for all of our patients. We are in a Mediterranean country, however, we treat patients from all over the world. So definition of success varies. Generally, this could be parenthood. However, some women and some men are determined to have parenthood with their own genetic material. So despite the multiple failures, for example, a 45-year-old woman would not consider egg donation, and this is fine. However, they have to be aware of the odds, and they have to be aware that most likely they will keep on failing if they try with their own eggs at this age. And of course, equally, with severe male factors or with advanced male age, sometimes achieving a pregnancy with the man's genetic material may not be that likely. So define yourself and your partner, and as a couple, if you are a couple, define the success. Is it to become parents, regardless of the way and the means? Is it becoming parents with your own genetic material? Is it, does it not matter if it's your genes, if it's your eggs or sperm? Would you consider surrogacy? So for us, it's very important. My team and I, we always try to define for each individual patient and couple, how would they define success? But then, of course, try to empower them as much as we can based on their definition of success. If we define success with parenthood, overall, in my opinion, we can guarantee to any couple 100% success if they're wishing to explore all the options, which include egg donation, sperm donation, embryo donation, and surrogacy. We can explore more about this, of course, later on tonight. Now, number 8 is very important, and this has been a major issue. It's the issue of trust. I've taken my beloved ones as patients to doctors many times. My mother, my dad, my wife, my siblings, and so forth. And of course, I happen to know perhaps the best doctors. And however, sometimes I wasn't satisfied with them, and I had to move on. I had to get a second opinion and so forth. But I never sidetracked from this. I never sidetracked from telling myself, find the doctor you trust. If you trust them, let them do what's best for you. If you don't trust them, move on. Do not torture yourself, and do not torture your medical team if you don't trust, if you don't have trust in them. Of course, trust is very difficult to build. Of course, it cannot be demanded. It cannot be dictated. So take your time and trust your team. If you don't trust them, move on. If you trust them, give them the opportunity to do what's best for you. This is my number 8 advice, and this is what I've been following as a patient for myself and for my beloved ones. Number 9 is hope. It's easy to lose hope, but don't lose it. Don't give up hope. We are in the 21st century. We're going through difficult times, but hope is there. Fertility has evolved dramatically over the last so many years. I started my fertility journey as a doctor in the early 90s. I was fortunate enough to be the 3rd generation of fertility specialists. In those times, in Bristol, in Norwich, in Newcastle, in Manchester, in Middlesbrough, in Gateshead, of all places, and in London, of course, I had some people who carried me on their shoulders, and they kept giving hope, because as a doctor, as a young doctor, when we were quoting 10 and 15% success rate, because that was the average success rate of IVF in the early 90s, I was getting discouraged. How would I empower my patients if I was losing hope myself? Now things have moved on. We can quote easily 35, 40, 50% success rate, depending on the age group. We can quote 70% success rate if we're using egg donation on a healthy patient. And we can quote very near 90 or 95% cumulative success rate with egg donation, for example, and surrogacy to almost every couple. So there is hope. Try to identify it and try to fight for it. And this is my number 10. Keep on fighting, guys. It's not easy. Difficult times. COVID situation is a nightmare for all of us. Every time I have a Skype or a consultation with a couple, and I do quite a lot of those every day, I keep telling them how stressed we are. We are very stressed because we can't treat you the way we would like to. We can't have you out here as often as we would have liked to. We cannot communicate. We cannot hug you. However, we keep on fighting. We do have the means. We have hope. We have the knowledge. We have the will. We have the team, and we have each other. So keep fighting until you get there, because you will all get there. This is what you deserve. Thank you so much. Thank you.
And excellent. Thank you so much, Dr. Tsakos, for those tips, okay, and of course for encouraging words. That means to a lot of our patients a lot. So thank you for that, okay. And now we will start with our Q&A session. So of course, if you have any questions, just go ahead and type those in right now. And the first, well, actually, the first one is not a question, but I definitely want you to see. This is the comment. It's so great to hear a doctor talk in such a positive way about the non-medical aspects of IVF.
Thank you, Joshi. It goes without saying that women are not just a uterus and a couple of ovaries. There's much more in a woman. And similarly, a man is not just semen analysis and a few million sperm. We need the multidisciplinary team that would make our job easier. Most aspects of medicine, cancer medicine, rehabilitation medicine, um, endometriosis, pain medicine, they work as teams. I think it's time that as fertility specialists, we acknowledge the importance of a team and the importance of integrated care that includes the mind and the soul of our patients, not just their body.
And wonderful. Thank you so much for saying that as well. And of course, for that comment. Couldn't agree more, as I've already mentioned. And we need to wait a bit, okay? Dr. Tsakos, someone is typing. So, of course, I understand. Yes, questions are coming up. So, let me just go to the next question. So, do you help with many foreign patients in your clinic? Are the people that work with the patient used to work with English speakers or others?
Sure. I mean, in our clinic, 100% of our staff speak English fluently, and between us, we speak about 10 foreign languages. So, on balance, we can treat patients from all over the world. I mean, after the quarantine, we had people flying from Singapore as far as Dubai, Saudi Arabia. We had patients from the US, Australia, Spain, and of course most parts of Europe. So foreign language is not a problem.
That's excellent. Thank you so much again for your question and, of course, for help with that. Another one is definitely interesting question. So, 6 months plus of COVID, are you still getting new donors to your clinic?
Yes, interestingly, after the quarantine, we had an absolute flood of donors, egg donors, coming in to donate. And we were quite shocked by it because we never expected it. However, most of them, the explanation was that they felt that that was a way to help their fellow human beings. So that was a reflex reaction from people wishing to donate and offer. So yes, we still do get quite a few donors in our clinic.
All right, that's good to hear then. Okay, thank you so much then for that. And more questions are coming up, so let me go to the next one. How long would you advise to try the same protocol when repeatedly egg retrieval is unsuccessful? No oocyte picked up, despite scans showing normal follicle growth and normal hormone levels at day 2 and just before retrieval?
Yeah, I mean, this is a very technical question, and it's for me, it's very, very simple and very clear. Ovarian stimulation is a subject that we could explore for days without even getting anywhere near it, sorting it out and agreeing at what's best. However, it has a few very important principles. First of all, is how do you define success? What's the optimum number of follicles and oocytes one would expect from each individual? And there's a lot of markers that would define that. So, for example, the age, the AMH, and the antral follicular count is one of the essential markers. So, for example, if we have a 35-year-old with a normal AMH and a follicle count of, say, 10, we know by definition that if we get less than 10 eggs, then perhaps there's something wrong with it. So this is very important to communicate with our patients. I mean, the AMH, as most of you know, is a very important surrogate marker for that. and my team and I have been one of the few in the world who studied and published that more than 10 years ago. So it is important for the lady, for the woman who is about to be stimulated, to have ovarian stimulation, to be aware of what's the successful outcome and what is the definition. Now, following that, the protocols. The protocols are quite a few. So the definition of a successful protocol is the one that helps the patient to reach the number of follicles and oocytes that were defined initially. So there's a lot of things that can go wrong with the protocol. Over the years, I mean, I found that ovarian stimulation varies. And of course, there's a fixed way you can do it, which means that you can more or less standardize the protocol, which means that you stimulate roughly with one way, with one mode, with one principle, if you like, minimizing the number of clinic visits and scans, which is very tempting and very convenient for our patients, especially when they're from far away, or especially when scanning and blood testing is expensive. So it's convenient for the patient if you tell them, oh, you don't need a baseline scan, and you know, we don't need to see you before we add on the antagonist, and we'll see you once or twice at the minimum cost and then go for stimulation. However, although in some cases this may work, if we want to tailor make our program, and if we want to be bespoke, this may fail perhaps 10 to 20% of our patients. And of course, this is an absolute disaster. So in my opinion, if the unit has the facilities to provide tailor-made treatments and tailor-made protocols, I think it's very important to have a baseline scan plus another 2 to 3 scans in order to define exactly the optimum dose, and of course the optimum timing and the method for final triggering. Now, another big issue, of course, is how to trigger, when to trigger. Do you trigger at 17 millimeters or do you trigger at 19 millimeters? Can you pick up, for example, on Saturdays and Sundays, or can you only pick up on Monday, Wednesday, Friday, like some units do? And of course, this is something that the patient should reflect, perhaps after a failure or even before the failure, by evaluating those important factors. Is the clinic working 7 days a week? Is the clinic able to scan and get the reports of blood testing within a couple of hours or 4 hours any time of the week? And of course, this may influence a little bit of success. And of course, this may not be that important for the 35-year-old with 10 eggs, but it may be very important for the 41-year-old with 3 eggs, because it would make a huge difference if we collect on a 40-year-old 1 egg or 4 eggs. So stimulating the ovaries and ovarian stimulation is not an easy thing, and is not, in my opinion, something that should be totally standardized and totally rigid. It has to be individualized, and we have to have the opportunity to modify the protocols depending on the response. And of course, how do we measure hormones, and what kind of hormones do we measure? Do we measure progesterone? Do we measure LH? Is it important if we measure estradiol? And then we're going on to the pickup. You know, most of us, when we were learning, we were told that perhaps the ovarian, the egg collection is okay, suitable for a more junior doctor, and whereas the embryo transfer should be in the hands of the more experienced doctors. I would probably disagree, because again, the technique of the pickup is very important. And of course, the technique has to do also with the patient, with the anesthesia. Some people still do ovarian pickups without anesthesia or with very mild local anesthesia, which may be fine for most of the patients. But for the individual patient with a difficult access or with some sort of pelvic adhesions that doesn't allow the operator to collect all the eggs, may make a little bit of a difference. And of course, who is doing the egg collection? Is it a research fellow? With all due respect, that's how we all learned. But of course, the yield of eggs and the quality of the yield of the eggs that were collected may be a little bit different if you have an experienced consultant versus a young research fellow. And of course, the conditions in the lab at the time of their collection, I could go on forever. So in my opinion, a failed pickup, for example, or a bad stimulation or a bad egg collection doesn't necessarily mean that this is the potential of the ovarian capacity of any woman. And I'm sure there's always perhaps a little room for improvement.
And wonderful. Thank you so much for your question and, of course, for your thorough answer to that. Although, yes, it's true, we might actually have another webinar, whole webinar on that particular topic. So thank you for that. Okay, and let's have a look. Of course, there are more questions. So what lifestyle tips do you have to help with IVF success? Exercise, diet?
Right. Well, let me tell you my opinion. I think most people know what they should do. The question is whether they can do it or not. I know, for example, that I should be seeing my children a little bit more, but I can't do it. And equally, if somebody has not got the perfect lifestyle, they know what they need to do, but they can't do it. So what do they need? They need a bit of motivation. So I'm not going to give any particular tips. All I'm going to say is that respect your body, your soul, and your mind, and they will pay you back. If you invest in them, the investment will grow. So invest in your body. How? Start with a small investment, 30 minutes a day. Take a short walk. Take a longer walk, 30, 45 minutes a day. For most people, that's more than enough. And the same applies with diet. The same applies with any techniques for relaxation, perhaps, for acupuncture, for fertility massage, if it's available in your area. Anything that could empower and cultivate your soul and your mind would be helpful. Of course, smoking, alcohol, most people know all of that. So we all know what perhaps we need to do. It's just a matter of deciding that tomorrow is the time to start.
Understood perfectly. Once again, thank you for that. All right. Next question is, do genetic tests make things more successful by spotting embryos that would not result in live births properly? And do they detect Down syndrome?
Difficult. Maybe is the answer. Maybe. Maybe, but not definitely. I mean, there's a lot of controversy concerning genetic testing, PGS, PGTA, as it's called now. I can begin by saying that it's not for everyone, that there are only some indications in which it may improve the success rate, and that in some countries, including Greece, they are heavily regulated by fertilization authority, so that it's not sold to the patients as a size-fits-all and as the holy grail of IVF. And I more or less respect that opinion. So somebody who's starting IVF at 35, who's had maybe one failure or no failures, I don't think that PGS would make a huge difference. However, somebody with repeated failures or with miscarriages or with a female age over 40, in that case, yes, PGTA may be associated with a better outcome, not necessarily better success rate, but maybe better experience, because it's more empowerment to the couple to know that at least they are transferring healthy embryos. The reduction of multiple pregnancies by eliminating the abnormal ones and therefore implanting one healthy blastocyst, for example, and so forth. So the straight answer is that genetic tests is not for everyone, that we should be very scientific about it and less commercial. And I think there's still a little bit of way to go before the indications grow more compared to what I've just mentioned.
And again, thank you so much for that question and, of course, your answer to it. Next question is right here. So what is the age limit for egg donation in your clinic, and do you offer surrogacy as well?
Yeah, the age limit, the female age limit at the moment is 50 for the female, and there's no limit for the male. So, which is a little bit of a discrimination, but never mind. We're hoping that the female age limit will be moved up to 53, if not 55, in the next few months. In fact, I'm on the board of the Hellenic Fertility Specialists Association, and we have put in proposals to increase the female age to 53. Now, with regard to the egg donors themselves, the indicated age is between 18 and 35. However, in our clinic, we only use donors up to the age of 30 maximum in order to maximize the results and the success. Surrogacy, yes, we do offer. And if I can talk a little bit about surrogacy. Surrogacy in Greece is legal and regulated. Greece is the only country within the European Union in which surrogacy is legal and regulated. And therefore, we have a lot of requests and a lot of patients from all over Europe and also across the Atlantic from the US and Australia. The benefit of having a European Union country is, of course, the ease of travel, especially now with COVID times, as you probably all know, traveling within the European Union is possible, whereas it's not possible to travel outside the European Union. For example, in Greece, we have border with Albania, and the Albanians are not allowed to travel into Greece at all. Neither are people from Turkey and Serbia at the moment, although people from European Union are allowed to fly on conditions. From the UK, there's no particular conditions apart from the passenger locator form. From other countries in Europe, like Belgium, where I was a few days ago, the passengers need to have a COVID test. However, it is possible. And of course, you understand the implications of that in surrogacy. You understand how important it is to be able to travel and pick up your child when your child is born if you're not living here, or to visit the surrogate if you're not living here when there's an issue, or to surprise her or whatever. So this is one of the main advantages. The second main advantage with Greece being within the European Union is the exit process of the child. So after the child is born through surrogacy, getting all the papers in order to bring the child back home to the UK or to other European countries is very straightforward, unlike other countries outside the European Union, where indeed there could be major issues with the exit process. And the last advantage is that the general standards of IVF and of course of obstetrics and delivery in hospitals is quite similar in most of the European Union countries. And of course, this is building the trust, and this is improving the experience. One of the last advantages about surrogacy in Greece, and this is one of the reasons why we have a lot of Australians coming out and preferring Greece as opposed to the US, is that, and of course a lot of people from the UK, is that the court order is issued before the process of surrogacy begins, which means that the child is of the parents, the intended parents, before even it's conceived. And of course you understand the importance of that in both legal and practical terms.
And perfect. Thank you once again for explaining this question. Now we will go to a bit of a longer question. Okay, let's have a look. I'm 43. My husband is 44. I have 2 AMH, mild endometriosis, 2 prior miscarriages, and I'm overweight. My husband has DNA fragmentation, poor motility count. What are our chances using our eggs and sperm? If we were to use donor, would it make sense to do donor egg or donor sperm? He had a TESA in August, so I'm assuming we shouldn't use fresh sperm from him for a year. Is that correct? was thinking that if he loses his weight and did more acupuncture, his quality may improve compared to his frozen sperm.
Well, difficult. I'm sorry, I can't really be very clear in my answer. All I have to say is that, of course, the options are there. I think you need some heavy counseling. Of course, fertility counseling with regards to your options. It's not impossible for a 43-year-old with 44-year-old man with poor sperm to be successful with their own genetic material. However, that has to be explored separately. And of course, the option of egg donation or embryo donation is there as well. So very difficult to answer that. All I have to say is that in view of the miscarriages, please do not underestimate the importance of anatomy, of your anatomy assessment. Let's talk now a little bit about the hysteroscopy. In my opinion, this is an amazingly useful procedure, and most of us, including of course our team, we are able to perform the office hysteroscopy, which is a little bit more advanced than a scan. It doesn't require anesthesia, and of course it ensures that there's no major issues with the uterus. Now, because of the endometriosis, please be aware that endometriosis may have damaged your ovaries and equally may have damaged your tubes. And please exclude conditions like hydrosalpinx before you move on to another implantation. Now, whether acupuncture can improve or not sperm, I think his frozen sperm, I'm not sure. But in general, acupuncture does have some benefits for fertility patients as long as it's used in an integrated fashion as part of the overall rounded approach for the individual couple.
And again, thank you so much for that, Waspar. Okay, there are like 2 questions left, so we will be slowly finishing. So if you have any questions left, just go ahead and type those in the chat section. And the question that we have here is, what's your personal view on fresh versus frozen embryo transfer? We've had 3 fresh ICSI transfers. We are now thinking to do embryo banking at frozen embryo transfer.
I have a very clear view on this. Depends. If the fresh transfer is optimal, then in my opinion, we have no reason to freeze electively and move on to a frozen embryo transfer. Now, how do we define an optimum fresh transfer? Firstly, we don't want hyperstimulation, so we don't want more than perhaps 12 or 14 follicles, and we don't want very high levels of estradiol. We don't want high progesterone levels on the day of trigger or 1 or 2 days before that, because progesterone would be detrimental for a fresh embryo transplant. And of course, we want a healthy-looking endometrium on scan with normal perilaminar appearance and normal thickness and all that. And if all of this is optimal, then I can't see why we can't go on for fresh embryo transfer. Of course, if there's any doubt about any of those factors, then again, depends on how many embryos we have. So for example, if we have 3 top quality embryos and one of those 3 factors defining the optimum conditions for first transfer, perhaps if one of those factors is gray, then perhaps we can do a single embryo transfer in the first cycle and then freeze the other embryos so that we have another attempt. So absolutely depends.
All right, of course, understood perfectly once more. All right, let's have a look. Another question is definitely an interesting one. When you mention mind-body aspects, what do you think of biodecodification, example approach that our emotions, beliefs, trauma, shock, create memories and blockages in your body?
Hi, Sushin. I must admit I'm not familiar with this, but I would be very interested to find out. So if you want to send me some details, I would very happily evaluate it.
Of course, no problem. Thank you so much for that question. Indeed interesting. And well, I will send you in a few minutes, like a link where sorry, you will be able to, of course, get in touch with Dr. Tsakos and his team, and I'm sure they will be also happy to help you. All right, now it looks like this will be our last question for today. Are you allowed to use only your gametes in surrogacy, or embryo donation is also allowed?
Hi, Beata. Of course, it's allowed. Yes, we can use any genetic material through surrogacy, and this is why I mentioned earlier on that with surrogacy we can guarantee a 95+% success rate, because you can imagine how successful one can be when one is using a healthy surrogate and healthy embryo donation, for example. So yes, donor eggs, donor sperm, donor embryos can be used with a surrogate.
And wonderful. Thank you so much for that clarification. And as I mentioned, this was our last question, so we will be finishing for today. So I would already like to thank everyone for joining us tonight, for your questions. And I'm sure this session has been very interesting for you, and I'm sure you found it very useful as well. Here's the link I have mentioned. Of course, if you'd like to get in touch with Dr. Tsakos and his team, this is the way to do it, and I'm sure they will be more than happy to schedule some consultations as well. So thank you, Dr. Tsakos. It's always a great pleasure to have you with us, and well, I know it's definitely late for you, so thank you for your time. And is there anything else you would like to add?
I would like to thank everyone for listening in. I would like to thank the organizers for this amazing initiative, and I would like to commit myself into another webinar if I'm invited. And it's been a pleasure sharing my small experience and knowledge on the subject. And I hope I have helped all of you listening in. Thank you very much.
And wonderful. And definitely you are invited. So I'm sure we will have plenty more of those events coming up. Okay. As you can see, there are lots of thank yous coming up here. Thank you very much. Very interesting. It's lovely to hear your encouragement. Thank you so much.
Thank you. Good night.
Thank you so much. And of course, remember, we will be back here on a Monday. And remember that this can be found on our My IVF Ancestors. So you can go ahead to the website and there will be your option to see it again. And of course, remember that on Friday, next Friday, we'll have another special guest from Greece. So you will be able to also find it, I hope, interesting. Everyone, wherever you are, have a lovely evening, have a lovely day, and have a lovely weekend. Thank you so much. Bye.